Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist from Houston, Texas. The feature presentation for this seminar is Does COVID vaccine increase the risk of myocarditis or inflammation of the heart muscle in young adult population? To answer this question, the Israelis looked at their population data which they have collected since 2020, ever since they started the vaccination. They have a population of 9.29 million people who have received the COVID vaccination, most of which is from the Pfizer group. 5.44 million people have received the first dose, whereas 5.12 million people have received both doses of COVID. And they have been following this population along with the population that has not received the vaccination to look at the incidence of myocarditis or inflammation of the heart muscle during the course of this COVID pandemic. The total number of myocarditis seen in the 9.2 million people who had received the vaccination was 283 total cases. After the first dose, there were 142 cases reported, whereas after the second dose, the incidence was 196 cases. In total, they had 283 cases of COVID vaccine-related myocarditis among 2.9 million people who had received the vaccination. Comparing the data from the vaccinated group, they looked at a similar group of young adults who had incidence of myocarditis prior to the COVID onset. And they realized that the incidence of COVID-related myocarditis was 5.4 times higher among those adults who are receiving the COVID vaccine compared to those people who did not have the COVID vaccination. But the most important point I want to stress in this presentation is that 95% of the people who had developed myocardial inflammation or myocarditis were having very mild symptoms, and most of them recovered. It is a self-limiting condition. They reported only one death from COVID-related myocarditis among the 9 million people who had received the vaccination. So the incidence of myocarditis among COVID-related vaccines is slightly higher compared to those in the same age group who did not have vaccination, but 95% of them have very mild symptoms and they recover without any major sequelae. The important thing you need to do is, if you are having any cardiovascular symptoms like chest pain, shortness of breath, weakness, fatigue after COVID vaccination, I'm talking about 1 to 2 months after COVID vaccination, then you should consult with your primary doctor and perhaps see a cardiologist and get blood tests done and ultrasound tests done so that you can be followed up very closely to see what the natural course of myocarditis is in your particular case. I hope this has been useful to you. Thank you so much for watching this presentation, and please do subscribe to our YouTube channel, and I will see you in the next video.